Because you clicked on this video, there's a good chance you already know just how miserable back pain can be. Not just uncomfortable, not just annoying, but truly exhausting, draining, and sometimes life-consuming. Back pain has a way of taking over everything. It can make getting out of bed feel like a challenge. It can turn a short walk into an ordeal. It can make sitting, standing, sleeping, driving, working, and even spending time with friends feel like hard labor. And perhaps one of the most frustrating parts of the experience is this. When you're in desperate need of help, you go to a doctor hoping for answers, only to be told to rest, take some pain medication, and come back later if it doesn't improve. For many people, that advice can feel dismissive. You might leave thinking, how can this much pain be nothing serious? Or what if they've missed something? Or even, why does it feel like no one understands how bad this is? In this video, I want to turn that experience around. I want to give you an insider's look at how doctors think about back pain. More importantly, I want to walk you through the 7 warning signs that make doctors more concerned that there could be a serious underlying cause. These are the features that shift back pain from something that is usually mechanical and self-limiting into something that needs closer attention. Now, before we begin, let me reassure you of something very important. Most back pain is not caused by cancer. Most back pain is not caused by infection. Most back pain is not caused by spinal cord damage. Most back pain gets better with time. But medicine is partly about reassurance and partly about pattern recognition. A doctor's job is not only to help you feel better, but also to recognize when something uncommon may be hiding behind a very common symptom. And back pain is extremely common. Around 4 out of 5 people will experience low back pain at some point in their lives. That means it is one of the most universal health problems people face. Some people can point to an obvious trigger. Maybe they lifted something heavy. Maybe they twisted awkwardly while exercising. Maybe they spent hours in an uncomfortable posture, traveled for too long, or overdid a workout. But for many others, back pain seems to come out of nowhere. One day everything feels fine, and the next day they can barely bend forward to put on their shoes. That unpredictability is one reason back pain can feel so alarming. Another reason is that the lower back is packed with structures that are highly sensitive. Muscles, ligaments, tendons, joints, discs, and nerves all sit close together in a relatively small area. When any one of these becomes irritated, inflamed, strained, or compressed, it can produce pain that feels severe and disproportionate. This is why even a relatively minor back strain can feel dramatic. So let's begin by understanding the 2 broad ways doctors think about back pain. On one side, there's musculoskeletal back pain. On the other side, there's pathological back pain. Musculoskeletal back pain is by far the most common type. This is the kind that comes from strains, sprains, irritated joints, tight muscles, overloaded tissues, minor disc problems, or general wear and tear. It may be painful, and sometimes extremely painful, but it is usually not dangerous. It often improves with time, movement, pain relief, and in many cases, physiotherapy. Pathological back pain is different. In this context, pathological simply means the pain is being driven by an underlying disease process rather than a simple strain or overload. That disease process could be infection, fracture, autoimmune inflammation, cancer, or significant nerve injury. The key thing to understand is this: pathological causes are much less common, but they matter because they are the ones doctors do not want to miss. That is why, when you visit a doctor with back pain, they are doing 2 things at once. First, they are trying to help you manage the symptom. Second, they are quietly scanning for clues that point toward a dangerous cause. And to understand that better, it helps to know a little about the lower back itself. Your lower back is a complicated and brilliantly engineered structure. It is made up of bones called vertebrae, which are stacked on top of one another to form the spinal column. Between these vertebrae sit discs, which act like cushions or shock absorbers, allowing movement while helping distribute force. Running through the spinal column is the spinal cord, which is one of the body's major information highways. From that cord, smaller nerves branch off and pass through narrow openings between the vertebrae to reach the legs, the muscles, and the pelvic organs. Holding all of this together are ligaments, tendons, fascia, and layers of muscle. These structures work together to help you bend, twist, rotate, stabilize, lift, and walk. But because so many moving parts are packed into one area, Pain can come from multiple places at once. A strained muscle can hurt, an irritated joint can hurt, a bulging disc can hurt, nerve irritation can hurt. And because all of these structures live so close together, it is often impossible for someone to pinpoint the exact origin of the pain on their own. That is why the story around the pain matters so much. Doctors don't just ask, "Where does it hurt?" They also ask, "How did it start? How long has it been there? Is it getting better or worse? Do you have any other symptoms? Does anything about this pattern feel unusual?" Those details matter because back pain is common, but dangerous back pain usually leaves a trail of clues. So let's go through the 7 signs that make doctors pay closer attention. Warning. Sign number 1. Pain that persists beyond 6 weeks. One of the first things doctors consider is duration. Most uncomplicated musculoskeletal back pain improves with time. It may not disappear overnight, and it may fluctuate, but the overall trend is usually toward improvement. If someone strains their back, irritates a joint, or overloads a disc, the body often begins repairing the problem over the following days and weeks. That's why many doctors become more concerned when pain lasts beyond 6 weeks, especially if it remains significant and doesn't seem to be moving in the right direction. Now, this is important. Persistent pain does not automatically mean something serious is going on. Lots of people have back pain that lingers. Some develop chronic back pain without an infection, fracture, or cancer ever being found. But when pain lasts longer than expected, doctors begin to ask a different question. Instead of assuming it is just a simple strain, they start thinking, is there something else here that deserves a closer look? Sometimes the answer is still no. Sometimes the pain is simply stubborn. Sometimes poor sleep, stress, fear of movement, muscle guarding, or deconditioning all contribute to a cycle that keeps the pain going. But the longer symptoms continue, the more important it becomes to reassess the picture rather than just assume it is the same minor problem. From day one, DONS alone is not enough to diagnose anything, but it is enough to move the case from probably routine into worth reviewing more carefully. Warning sign number 2. Pain that progressively escalates. The second thing doctors worry about is the pattern of worsening. Musculoskeletal back pain often behaves in a somewhat inconsistent way. One day may be better, the next day may be worse. Rest might help a little, movement might loosen it up. You may think you're recovering, then have a setback, then improve again. That uneven pattern is common with routine back pain. Pain driven by a pathological process often behaves differently. Instead of waxing and waning, it tends to keep building. It is the pain that doesn't just stay bad but becomes steadily worse. It may intensify despite rest. It may begin to interfere with sleep more and more. It may spread. It may become less connected to movement and more present all the time. That progressive pattern makes doctors stop and think. Why? Because if there is an active disease process underneath the pain, something like infection, inflammation, fracture instability, or a growing lesion, the pain often follows the biology of that problem. It doesn't simply flare and settle. It continues to advance. A person might say, "At first it was uncomfortable, but now every week it's worse." Or "Nothing I do changes it anymore." Or "It started as mild pain, but now it's constant and intense." That kind of story doesn't prove a dangerous cause, but it gets attention. Doctors are trained to notice trends, and a steadily escalating pain trajectory is one of the trends they take seriously. Warning sign number 3. Fever or night sweats. The third warning sign is when back pain is accompanied by fever or night sweats. Most ordinary back pain does not come with signs of systemic illness. If your pain is caused by a strain, a posture issue, or an irritated disc, you might feel sore and miserable, but you usually won't feel feverish, sweaty at night, or generally unwell in a flu-like way. When fever enters the picture, doctors start thinking about infection. Spinal infections are not common, but they do happen, and missing them can be dangerous. The risk is higher in certain groups, including people who inject drugs, people taking immunosuppressive medications, people with weakened immune systems, and people living in places where certain infections such as tuberculosis are more common. An infection can involve the disc, the vertebrae, or the tissues around the spine. In some cases, pus can collect and compress nearby nerve structures. In other cases, the infection quietly damages bone or disc tissue until the pain becomes severe. Night sweats can also raise concern because they may signal infection, or in some cases, malignancy. Again, This does not mean every person with back pain and a fever has a spinal infection. Sometimes the fever is unrelated. Sometimes a viral illness and back pain happen to overlap. But if someone has significant back pain and also looks systemically unwell, doctors shift gears quickly. They may order blood tests, imaging, or urgent assessment, depending on the overall picture. Back pain plus fever is never something to casually ignore. Warning sign number 4. New back pain in someone over 50. The fourth warning sign is age. Particularly when a person over 50 develops new back pain, age by itself is not a diagnosis. Plenty of healthy adults over 50 develop routine mechanical back pain. But statistically, certain more serious causes of back pain become more likely as we get older. Fractures are one example. Bone density often decreases with age, particularly after menopause. This means a woman over 50 may be at increased risk of a vertebral compression fracture, sometimes even after relatively minor strain. A person may not remember a dramatic injury. It might have happened during a lift, a fall, or even a movement that seemed ordinary at the time. Cancer also becomes more common with increasing age, and some cancers can spread to the spine. So when an older adult presents with new, unexplained back pain, especially if there are additional red flags, doctors are more alert. This doesn't mean age over 50 should cause panic. It simply lowers the threshold for a more thoughtful evaluation. Medicine is always about context. If a 25-year-old athlete develops back pain after deadlifting, the likely explanations are different from those of a 68-year-old with no clear trigger, worsening night pain, and weight loss. Same symptom, very different context. Very different level of concern. That's why age matters. Not as a verdict, but as part of the pattern. Warning sign number 5. Unexplained weight loss. The fifth sign that raises concern is back pain associated with unexplained and unintentional weight loss. If someone tells a doctor, "I haven't been trying to lose weight, but I've dropped several kilos," that changes the conversation. Unintentional weight loss can be a sign of many medical conditions, including cancer, chronic infection, endocrine disease, gastrointestinal illness, or other systemic problems. In the context of back pain, doctors particularly think about malignancy. Cancer can start in the spine, but more commonly it starts elsewhere, and later spreads to bone. The spine is a relatively common place for metastases to lodge, especially from cancers such as prostate, breast, lung, kidney, or thyroid. Why does cancer cause weight loss? Because cancer changes the body's metabolism. Tumors may consume energy, alter appetite, trigger inflammation, and lead to overall wasting. People may feel tired, eat less, and slowly lose weight even before a diagnosis is made. Of course, weight loss is not always sinister. Stress, depression, dietary changes, grief, overwork, or other illnesses can also cause it. But when weight loss appears alongside persistent or worsening back pain, it becomes a red flag that doctors cannot ignore. This is one of the reasons clinicians ask questions that may feel unrelated at first. How is your appetite? Have your clothes become looser? Have you been trying to lose weight? Any change in energy levels? These questions help determine whether the back pain is a local problem or part of a much bigger story. Warning sign number 6. Severe spinal stiffness. The sixth warning sign is severe spinal stiffness, particularly when it seems out of proportion or is associated with long periods of morning stiffness. Some people with back pain don't mainly describe pain. They describe restriction. They say they feel locked up, unable to bend, unable to twist, as though the spine itself has become rigid. In younger people especially, one condition doctors consider is ankylosing spondylitis, or a related inflammatory spinal disease. This is not the same as a simple back strain. Inflammatory back pain often has a characteristic pattern. It may be worse first thing in the morning. It may improve with movement rather than rest. It may cause prolonged stiffness after inactivity. It may come with fatigue. Sometimes there are associated issues like eye inflammation, bowel symptoms, or pain in other joints and tendon insertions. Over time, untreated inflammation can lead to progressive loss of spinal flexibility and, in severe cases, fusion of parts of the spine. This is why early recognition matters. These are not conditions where the goal is simply to wait it out and hope it settles. They often require proper diagnosis, targeted treatment, and long-term management. Now, not every stiff back is inflammatory. Many people feel stiff because they are in pain, because their muscles are guarding, or because they've become less active. But when the stiffness pattern is striking, especially in combination with age, timing, and other symptoms. It becomes something doctors think about carefully. What matters is not just that the spine feels stiff, but how that stiffness behaves. Warning sign number 7. Signs of nerve injury. The 7th warning sign is evidence of nerve injury, and this is one of the most important categories of all. The lower back is not just a mechanical structure, it is also a passageway for major nerves. When those nerves are irritated, compressed, or damaged, the symptoms go beyond pain. In milder cases, someone may experience tingling, numbness, shooting pain down the leg, altered sensation, or weakness in part of the leg or foot. This can happen when a disc bulges or herniates and presses on a nerve root. Often this is painful and distressing, but not always an emergency. Depending on the severity, treatment may include pain control, physiotherapy, careful monitoring, and sometimes imaging if symptoms are significant or persistent. But there is a more severe end of the spectrum, and this is where doctors become urgently concerned. If someone develops loss of bladder control, bowel dysfunction, numbness around the genitals or buttocks, or profound weakness in the legs, doctors worry about serious compression of the nerves at the base of the spine or even spinal cord-related compromise, depending on the level involved. These are emergency symptoms. They can suggest major nerve compression, such as cauda equina syndrome, which requires urgent medical assessment and often urgent surgery. Delay can lead to permanent loss of function. This is why doctors ask seemingly strange questions when evaluating back pain. Any difficulty passing urine, any urinary incontinence, any numbness in the saddle area, any new weakness in the legs, any loss of bowel control? These are not routine questions asked for no reason. They are screening for problems that must not be missed. It's worth emphasizing that many people with sciatica or a disc bulge do not need emergency surgery. But the presence of red flag neurological symptoms changes everything. It means the pain is no longer just about comfort. It becomes a question of protecting nerve function. What doctors are really doing. During a back pain assessment, when doctors assess back pain, they are not only looking for a diagnosis. They are trying to answer a risk question. Is this likely to be routine musculoskeletal pain? Or does this pattern suggest something more serious? To answer that, they combine several things: your age, your symptom pattern, your medical history, any recent injuries, any systemic symptoms, any neurological signs, your risk factors, and their examination findings. That is why a medical consultation for back pain can sometimes feel surprisingly broad. You may expect the conversation to stay focused only on the back, but instead you get asked about weight loss, fever, cancer history, bladder changes, medications, injections, immune problems, and morning stiffness. Every one of those questions is part of a filter. Doctors are trying to separate the very common from the potentially dangerous. And here is the difficult truth. Sometimes severe pain is still mechanical, and sometimes relatively modest pain has a serious cause. Pain intensity alone does not tell the whole story. That can be hard for patients because it can feel unfair. If the pain is intense, you naturally assume something catastrophic must be happening. But tissues like muscles, ligaments, and discs can generate extraordinary pain without there being a life-threatening disease behind it. This is one reason some people feel frustrated when they are told to wait, move gently, use pain relief, and begin rehabilitation. It may sound passive, but in many cases it is the correct approach, because the body is already doing the work of healing. The skill lies in knowing when not to reassure too quickly. A quick word about chronic back pain now. Many of you watching may be dealing with back pain that has lasted not just 6 weeks, but 6 months, a year, or even longer. And maybe you've had scans, maybe you've had appointments, maybe you've seen doctors, physiotherapists, or specialists. And despite all of that, no clear pathological cause has been found. That situation is real, it is common, and it is incredibly frustrating. This is what we often call chronic back pain. Chronic back pain is complex. Sometimes it begins with a genuine physical injury, but over time the body's pain system itself can become more sensitive. Muscles may become guarded. Movement may become feared. Sleep may worsen. Stress may amplify pain processing. The brain and nervous system can become more efficient at producing pain, even after the original tissue injury has healed. That does not mean the pain is imagined. It does not mean it's just in your head, and it does not mean you are weak. It means pain is not only about damaged tissue, It is also about how the nervous system interprets threat over time. Chronic pain sits at the intersection of biology, movement, psychology, sleep, stress, and behavior. That's what makes it so difficult, and why it often requires a broader treatment approach than simply resting or taking tablets. If you'd like, I can create a full separate script just on chronic back pain, why it happens, and what can actually help. So, when should you seek medical attention? If your back pain is new, mild to moderate, and clearly linked to a strain or awkward movement, it is reasonable in many cases to monitor it, stay gently active, use simple pain relief if appropriate, and see how it evolves over a short period. But you should seek medical attention sooner rather than later if your pain is not improving, is steadily worsening, or is accompanied by any of the 7 signs we discussed: pain lasting beyond 6 weeks, pain that progressively escalates, fever or night sweats, new back pain after age 50, unexplained weight loss, severe spinal stiffness, or any sign of nerve injury. And if you have symptoms such as urinary incontinence, bowel dysfunction, numbness around the buttocks or genitals, or rapidly progressive leg weakness, that is not something to casually wait on. That needs urgent assessment. It is always better to be checked and reassured than to ignore a pattern that may matter. Sponsor segment before we finish, I want to briefly thank today's sponsor, Skillshare. There is no doubt that modern life encourages us to be more sedentary than previous generations. We spend more time sitting, more time hunched over screens, more time commuting, and often less time moving in ways that maintain flexibility and joint mobility. One of the hidden costs of comfort is stiffness, and over time that stiffness can feed into aches, postural strain, and reduced movement confidence. This month, I took the class Yoga for Flexibility by Abby Carver on Skillshare, and I genuinely enjoyed how practical and accessible it was. Abby breaks down yoga poses in a way that helps naturally lengthen muscles, improve joint mobility, and strengthen that mind-body connection many of us lose when life becomes rushed and sedentary. What I especially liked is that the program doesn't feel overwhelming. She uses short, follow-along sessions that can realistically fit into a normal day. For many people, areas like the hips and hamstrings become tight over time, especially if you sit a lot. Those restrictions can affect how you move, how you bend, and how your lower back feels during daily activities. I've personally picked up some useful stretches from the course and worked them into my own routine. If that sounds helpful to you, the first one, Zuzen people to use the link in the description or my code DOKUNLOCK will get a 1-month free trial of Skillshare. Final thoughts: back pain is one of the most common human experiences, but it becomes much less frightening when you understand how doctors think about it. Most cases are mechanical, most cases improve. Most cases are not dangerous, but doctors stay alert for patterns that suggest something more serious beneath the surface. That's why the story matters so much, not just where the pain is, but how it behaves, how long it lasts, and what other symptoms travel with it. So if you take one message away from this video, let it be this: back pain is common, but context is everything. If your symptoms fit the pattern of simple musculoskeletal pain, that is reassuring. If they fit one of the red flag patterns, that is a signal to get checked. And if you're someone living with chronic back pain, please know this: even when the cause is not dangerous, the pain can still be deeply real, deeply limiting, and deserving of proper care. Thanks for watching, and I'll see you in the next video.